and we need to become more accommodating to all the potential mothers and the pregnant mothers and in this case the breastfeeding mothers, where we encourage them, where I think once our society understands the benefits of breastfeeding, for example, how we need to modify our attitude towards it, how the employers need to honor more extensive time to mothers and also make accommodations on site for breastfeeding mothers, all work environments and both private and public sector.
Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 94. More great stuff with Ben the Homeopath. Welcome to All About Breastfeeding, the place where the girls hang out. I am your host, Lori Eisenstadt, IBCLC. Today, we are continuing with our featured guest, Ben. If you are new to the show or missed last week's show, you will definitely want to go back and listen to episode 94, as that was part 1. You will learn about Ben's background and how he came to be interested in homeopathic medicine. In today's show, we're going to dive deeper into what homeopathy is, how it can be helpful to you, and specifically, what kind of common health issues it can help you and your family with. Now, I know Ben mentioned a specific book called Homeopathic Remedies, and I will put a link to this in the show notes. To get that info, just go to allaboutbreastfeeding.biz. And don't worry if you can't remember all that Ben talks about, and if you feel like you needed to take notes. I kind of feel like that too with some guests. But you can look for the information in the show notes, or you can always listen to the show again when you're sitting down with pen and paper in hand. I've been known to do that also. So yes, this is one of those shows that you might want to take notes. All right, let's get started. What I would love to talk about now is I really want to know from your perspective, what are some of the ailments that women are coming to you during their pregnancy that is common pregnancy ailments that you're finding really great success with? Okay.
So during pregnancy, well, if you want to take it from the very beginning, initially is infertility. Okay. So that's kind of the number one thing, that anytime the body is not completely balanced, it's not going to get pregnant by default. So forcing it to get pregnant, obviously you're asking for more complications. Whereas when the body gets it to its optimal health or balanced health, then it's a lot easier for it to get pregnant. So the fertility becomes one of the first issues. Then after getting pregnant, now I do have to say that individuals who have received homeopathic treatment and have responded well generally go through that entire pregnancy and delivery process much easier. Just like, remember how we said if somebody consults you, chances are the whole thing is a breeze. This is the same way. So the most cases that I treat are the individuals who come to us as a referral because the problem has already arisen. And I can tell you what those are. Anything from the after pains to heartburn of pregnancy, to labor difficulties, to lactation issues, to mastitis, to nausea of pregnancy, and nursing difficulties are things. And also when they get acute conditions, like any condition during pregnancy that requires them to take either antibiotics or other things that the mothers don't want to do, that's when they come to us. Because again, with homeopathic medicine, we don't have to worry about are we harming the mother or the baby, or are we complicating that pregnancy process?
I imagine it's a combination, and you'll correct me if I'm wrong, with either not wanting to take certain medications or they have taken certain medications and they found that it's not working.
Oh, yeah. But probably the one that's not working is generally probably the number one. because people don't think of homeopathy as a first line of treatment, right? And the ones who have that already been treated, chances are they're going to have less complications anyway, right? You're right in that they have tried it and they really are not getting the results, but at the same time, they're not happy about the fact that they have taken drugs that have side effects. And I think that's a mother's innate, natural, inborn feeling that I'm yet to see a mother who is, when is pregnant, becomes very defensive when it comes to taking things that can be harming them or have any kind of side effects. So they never feel good about it anyway, even if it's something that's over counter and very seemingly threatening, they still don't like the fact that they have side effects that are associated with them. And most medications, if not all, they always do give you precautionary advice of it's best not to take if you're pregnant.
Right. Even if a mother isn't suffering with any kind of infertility issues and she conceives rather easily, and even if she hasn't having any first trimester medical concerns, it's sounding to me like it would still really be great for her to come in for, I'm going to use the word evaluation, and you can correct me if I'm wrong, for an evaluation with a homeopathic so that they can just do a whole evaluation so that their pregnancy as a whole can be gentler and easier on them without many of the common symptoms that we go through?
Oh, absolutely. So essentially, as you recall, what we do with homeopathy is only triggering your own healing response, right? We're strengthening your own immune by allowing the body do it on its own terms, right? We're triggering response. We're not forcing response. And as such, when you look at it, you can see that there is no mother, in this particular case, pregnant mother, that could not benefit from a healthier state. You see, this is not a form of a supplement. This is not a form of a medicine that's going to force change. This is a form of actually giving you a remedy that matches your existing state so the body itself starts to become more balanced. And yes, to answer your question, so the question becomes, can you afford becoming more balanced? Or can your immune afford becoming more stronger? Which means less likelihood of catching colds or some other condition, or if you have them, for it to clear sooner. Overall, stronger immune means less complications.
Yes, so we can think of homeopath as good prevention. Like, we don't need to wait to have acute symptoms before we come in to get help and get treated. We can come in as a preventative.
The likelihood of even any other condition to appear in the future becomes almost next to nothing. This goes with all the phases of life. This goes with and you can always survey those patients who are being treated homeopathically. For example, when the later ages, when they approach menopause, rarely do they start suffering severely from menopausal symptoms. You know what I mean? Same thing with during the pregnancy, that when the body is balanced, because in nature, it's not meant to go through hardship during pregnancy. But the problem is the stress that the body goes through of having to work over time, then the existing symptoms become exasperated, including emotional. And this is where a lot of postpartum issues happen, is because, and I'm sure all the mothers can agree, that they may have not been in the best ideal state prior to pregnancy, perhaps, or the process of pregnancy have created some stresses for them that then later on, emotionally, they start to feel some difficulties. And this is because everything becomes magnified. And I think most mothers and people who have delivered can testify to this, that whatever issue you have had at some point can get magnified because of the pressure that the body goes through.
So have you taken the time to do like case histories? And I'm not looking for you to give us a whole explanation at this moment, but what I'm curious is, do you have studies of moms that you have worked with who come to you during the very early stages of pregnancy for that kind of checkup and balancing, and see them through the pregnancy and see them through, let's just say, the first year postpartum? And are you seeing a definite marked difference in decrease of the negative symptoms that lots of moms go through with regards to feeling the blues and depression and other health issues and dietary issues and mom-baby issues and sleeping issues postpartum. Is there a great decrease in all those symptoms in the moms that you get to see from pregnancy beyond, and moms who wait to come see you when they're in a crisis mode, and how long it takes them to correct their symptoms?
I would have to say absolutely. And to take that a step further, another thing that we also see is that, for example, a pregnant mother, let's say, that comes to us, who's had, let's say, one or two other children prior, and let's say the mother has suffered from asthma before or allergies, we see that their children are also more likely to exhibit those conditions. Whereas the mothers who get treated homeopathically and have responded well, we see that they no longer pass that condition on to their offspring. In other words, those children are even less likely to develop other conditions that their older siblings had because they had inherited it from their parents.
So that's fascinating. And so it sounds to me that you're a lot like me in that when you get to see and meet and work with someone in the early stages of pregnancy, it's similar to the extreme joy that I get when I have an opportunity to have a consult with a mom before she's had her baby, because you're just taking a look at the situation. And I know from my perspective, I get real excited about it because I'm looking at this mom and I'm saying to myself, I'm just so excited because I really feel like I'm going to be able to give you some really good help, tips, suggestions, knowledge base that is going to help you preventatively rather than only just come to me when you're in a crisis mode. So that excites me beyond anything. And I imagine you feel the same way.
Oh, yeah, absolutely. And I think most, if not all, people that are involved in natural birth process and natural healing of any kind, primary reason that we're here is that genuine concern about healing and betterment of the health of both emotional and physical of everybody that we come in contact with. And like, for example, one of the things in order for maybe perhaps some of your audience in order to help them to better both understand and solidify what it is that we're talking about here, if you do go to our website, for example, which is at homeopathycare.org, we have patient videos. Now, if you see any patient video from anywhere of patients that have done homeopathy, one of the things that you see common in all the patients once they talk about their experience with homeopathy is that this improvement at the emotional plane, how they feel better emotionally. So that's interesting. And you can see that, okay, so if everybody who does that, what they have in common is that they also report, regardless of what the condition they come in for, is that they feel better emotionally. You can see that how a mother that's about to get pregnant or is pregnant about to deliver, how that shift in emotional, once they emotionally start to feel better, how that can impact the cell regeneration, the whole development process of that new baby.
One of the things I wanted to ask you that gets a little confusing to me, and I imagine to most consumers, is that I know the way that you do your work best is by sitting down with someone one-on-one and doing a complete evaluation and asking many questions and being able to get feedback. And then that's one of the ways that you're able to decide which remedies, single remedies, or a combination of remedies. And there is, we can easily go to Sprouts or Whole Foods, or, I'm just talking locally in Arizona, but any health food store, and even in mainstream CVS and Walgreens now, I've seen homeopathic tablets being able to be purchased. When my kids were little, many moons ago, I did not have access to anybody to help me with homeopathic medicine for my kids. So I bought a kit and I dabbled, and I think I did pretty well. They didn't have too many things going on, but there were definitely a few things that I really did see immediate results, which just spurred me on. But I surely wish that I would have had someone to consult with to kind of get to the right remedies a little quicker. And as I work with my kids, I started to learn more about which remedies worked and which one, because it wasn't always the same for each child. So I find it confusing that it works best with a full evaluation. You can really target for that person emotionally and physically. And yet we have remedies that we can just purchase. Now, I know I trust that, and I believe that there can be no harm done. But at the same time, I think it can be quite confusing or frustrating for parents who purchase the remedies and then for it to, quote unquote, not work. And maybe it wasn't the remedy itself that didn't work, but rather the right remedy and the right dilution or the wrong combination for their specific child.
Oh, that's very true. I mean, because one of the things, even during the acute care treatment, is that there's always more than one remedy for any condition, even acute, that could potentially work. Now, I have some suggestion for your audience that they can get started on their own. And then hopefully as they see the results, they can always find a homeopath that they can always consult with. And nowadays, the beauty of one of the advantages of advanced technology is that you could still find the best homeopath. And regardless of where they reside, you still can connect with them through Skype, through phone, through other means. That's a good thing to have nowadays. So that helps us to fill in the gap in areas where there are no local homeopaths. But I'd like to, if it's okay with you, mention some reference points for your listeners.
Yes, please.
That they can kind of start this process. So as you mentioned, there is, once the right remedy is given, there's a very high likelihood that there would be almost immediate response in acute conditions. So when we don't get a response from a remedy that you have used in the past, chances are, as Lori mentioned, that we may have not selected the right remedy. So I'm going to help you with giving you, for example, there is a book. It's called Homeopathic Remedies. That's the title. And it's by, the author is a naturopathic physician. His name is Asa Hershoff. So the first name is A-S-A and the last name is Hershoff. H-E-R-S-H-O-F-F. That's a very good, simplistic, first-time reference book to keep at home to treat non-life-threatening, non-chronic conditions. So if it's a condition you've had for years or months, chances are this thing may not be helpful. But if you're talking about a food poisoning that's just occurred, or there is urinary tract infection that has just happened, or an influenza, or a cold, or a cough, this would be a very good book to have at hand. So you can go to the section of coughs, for example, and then decipher to see between like the 6 or 7 remedies and its description, which one matches your child the most. Then you go to your local store and then you're able to pick the more accurate remedy. So that would be one place. The other thing is that if you go to our website, we have a section on the first aid remedies. Again, go to homeopathycare.org. And I have a list of, I think, the top 12 remedies that you really need to have at home. So you could just kind of print that list there and just purchase that and keep that at home so that you have some of the ones that for cases of like extreme emergencies, like if your child gets a concussion, first thing you want to do is give them some pellets of that Arnica 200C. This is not to delay medical care, by the way. This is so that you could reduce the complications that may happen while you take your child to the urgent care hospital, to your physician, whoever it may be that needs to care for them. Or if it's a 3rd-degree burn, your child has, just poured the hot boiling water over, and it can be very distressing, very extreme, situation. You give them a dose of Cantharis, which I have it on the website there, immediately while you do call 911 or while you do take them to urgent care and whatnot. And you can see incredible results from patients who use them where there is little to no scarring afterwards, and the whole healing process can be substantially reduced from weeks to months to just few days or hours in some cases. So that would be a place to start with some basic remedies you want to keep at home. And then also have this book so you can take with you whenever there is a acute condition to see what's the best remedy to be selected.
So if I'm hearing you correctly, what you're saying is that when non-emergent illnesses come up, that you're more likely to easily find a remedy that using the book and the symptoms that will help. But if it's anything emergency, there's still something homeopathically that you can do while you're getting that medical help. But the other take-home message that I'm getting is that if this is a chronic condition, this is not something that you just want to go read a book, look underneath your symptoms, if you've had chronic UTI for 5 years,
Correct.
and go to a store and pick up a couple of remedies and have this expectation for it to eradicate that UTI to never come back. A chronic condition is something that you really feel you really need to have a full evaluation, but something simple, something the first time around, then that's more appropriate.
Absolutely. Because the chronic condition, homeopathy deals with differently. Because let's say if you are having recurrent UTIs, for example, if you look at our last 10 patients who were treated for UTI condition, you see that they've received 10 different medications because they're 10 different individuals. However, when we are in a true acute condition, which is a short-lived, it's not chronic, it's not recurring and whatnot, then it creates a very specific state that a lot of times these acute remedies can capture and help you get over them relatively very quickly. Absolutely. But when something happens again, that means your body is struggling with getting rid of the root cause of why you're having it. And we don't believe two people have the same chronic condition for the same reason.
Taking a little break from the show to invite you to check out a few things that we have going on here at All About Breastfeeding. My favorite new thing to talk about is our Facebook group, where we get to connect with other All About Breastfeeding listeners. All you need to do is go to Facebook and search for these 4 words, All About Breastfeeding Community. Make sure the word community is in there, otherwise you get to the wrong page. Check out allaboutbreastfeeding.biz, where you can find out more information on scheduling an online consult with me so I can help answer any breastfeeding questions you have before your baby's born. There's also free checklists and handouts on breastfeeding, and a few more will be added each month. One last item to cover. I love podcasting so much, and I too have my favorite shows. And I like to subscribe to my favorite shows so I never miss one when they're released. I tend to forget that not everyone knows they can subscribe to shows that they really like and want to get on a regular basis. You can go to the search feature on iTunes, just put in the words All About Breastfeeding, which leads you to our podcast page, and all you need to do is subscribe to the show. Then you will be sure to never miss a show. All right, let's get back to the rest of the show. So in a good way, I bet you get real excited when you meet a mother who has been suffering with nauseousness during her pregnancy or heartburn, some of those very common conditions, and UTIs are prevalent during pregnancy. And I bet you anything, you get real excited when you're able to help a mom homeopathically, different than them having to take the antibiotics during pregnancy, for instance, for a UTI, which we all know that antibiotics are great. However, they're overused and they certainly do not help for chronic UTIs during pregnancy. So what I'm saying is I bet you get real excited when you're able to zero in on a remedy or two or treatment that really helps a mom during her pregnancy and she's able to avoid medication.
Oh, very much so, especially since the response is generally, we're talking matter of really minutes to hours versus days. And so, yeah, absolutely. And 80% of the time, it's that day that they feel the relief, which is, yeah, very, very, we're very happy to hear it because, like you said, especially with pregnant mothers, because you can't help but feel just a lot more even compassion for the new baby that's being developed, which you don't want to in any way jeopardize that environment.
Give me like 1 or 2 of the top common complaints that moms have in, let's say, the first 6 weeks postpartum that you commonly hear that you learned can be quickly resolved from an appointment with you.
Well, sometimes it could be the pain, like the after pains that still remain, the soreness from the labor and whatnot, right? Which, for example, arnica is the number one remedy that you would want to take in order to both reduce complications of infections, but also recover from bruises, soreness that kind of happens after labor. Now, sometimes if there's a great irritability, oversensitivity that a mother has after having delivered, or especially after when the child gets nurses, every time nursing the child, afterwards the mother gets this irritability, there is chamomilla, which is made homeopathic one, which you get in a pellet form, can be of a great help. The other main remedy that helps on nerves, and especially when there's a use of vacuum or forceps, which creates pain in the hips for the mother, is called hypericum, which again, they have that readily available. That's another remedy that can become very effective. The list kind of goes on.
What about one of the other very common things that I work with moms in talking about holding their babies and positioning their babies? Even if they're doing more laid-back nursing, there's still some degree of strength that they need to have in their arms and hands and wrists. And lots of moms really suffer after birth with those carpal tunnel-like symptoms of the tingling in their hands and wrists, and the like feeling like they're going numb in that area.
So there's a few different remedies that can be used there. Again, the number one becomes that arnica, because that soreness and bruising sensation can help. Another one is called rhus tox, which really comes from poison ivy. Those are the kind of joint pains that they get better by motion, but when they first starting to move the joint or the arm, they feel like extreme pain that gets better by continuous motion. Rhus tox is another kind of a remedy. So those are some of the ones. And then now this homeopathic remedies book, as I mentioned to you, also has more choices on each of these conditions that gives you 6 or 7 different medicines and the description of how each one of those work, which arnica should always be the number one thing to go to. Now, what they can also do is use that arnica cream topically in those areas that they feel that soreness.
You mean on their hands?
Correct. So the arnica cream can be used topically for the areas that is this thing. But if the soreness continues and it's a continuous soreness feeling, then take an arnica, perhaps a 200 dose of it. It would say 200 CK next to it. That would definitely help with giving them a palliative relief. And of course, by them getting proper instructions from you onto not to continuously overstraining a particular muscle, for example, and different ways that they can handle the baby and making sure that they're not continuously overstressing a particular muscle. But what they want to do is right away apply arnica cream topically and also take it orally if the pain is unbearable.
I'm also curious what your opinion is on when a mother gives birth and she's having all these hormonal shifts. It's my belief to a certain degree that their body should also be allowed to go and feel this natural process of postpartum blues. And I'm not talking about when they're really getting depressed and things are really changing very in a rough way hormonally. I also like to know your opinion, because I just think that sometimes we actually just need to go through that process. If we're comfortable with knowing and understanding that it's a normal process as we have this hormonal shift from pregnancy to birth to the early days of postpartum, always be trying to take something to make some general symptoms go away.
That's true. And that's one of the difficulties that we face in that we're used to whatever symptom, let's give it a medicine right away. You're absolutely about saying that not everything needs a medication, and allowing the body to process itself. Actually, you're helping the body to be able to learn to do things. However, if the feeling of sadness or, not feeling so positive goes beyond just in an hour or two, then we see that that's something that shouldn't really happen if it's really continuous and it's not clearing in of itself. But if it clears, you're not getting it again, obviously there's no need to do anything. But believe it or not, if the body is healthy, even that breastfeeding part actually will give the mother a sense of comfort the way the nature does in of itself, both baby and the mother, right? But if a mother feels that, I am getting irritated or I am getting overly Now, like you said, there are parts of it where you may become teary and emotional, but ultimately deep inside you feel good about it. You know what I mean? When it's a natural way of things.
Right.
Feel like yourself, like I am not being myself. And you feel, especially feelings of either rage or suicidal thoughts, those are no, I don't believe those are part of the natural process. And the only reason I'm saying that, Lori, is that because the ones who really give the proper delivery and everything goes well, they don't report any of that.
Right. And listen, I totally agree with you. I was just bringing that up as a point of reference in that we've really become a society that with the least little bit of baby blues and the least little bit of tearfulness, moms are looking to take something to make that go away. And, this is where we talk about education, about their caregiver understanding that the people who are around them postpartum, their partners, that they are able to see and look objectively in addition to what the mother herself is describing. So the last thing I ever want to do is hold a mom back from treatment because she's waiting for those symptoms to get better. But I just think that we still live in a society where I've certainly observed enough moms who are looking for all kinds of remedy and taking all different kinds of stuff to make my perception is a very normal shifting of their whole hormonal balancing workout. It's like the body is trying to work it out itself, and it's actually quite minimal. And perhaps it's better to just let it do it on its own with a watchful eye.
Oh, yeah, I mean, absolutely. I mean, actually, we even have a term in homeopathy with the point that you're making, which is extremely important, which is called the minimum dose. In homeopathy, the worst condition, we don't give more to get more results. We always are like, you have to get by with the minimum dosing. And I'm so glad that you mentioned that. Even on the acute conditions, when you start taking that remedy that you just purchased from the store, you take a dose like 3 pellets under your tongue of, let's say, of an arsenicum for like some stomach upset or whatnot. As soon as you see improvement, you don't take the remedy. Okay, so you don't take the remedy and you only repeat when you see the symptoms starting to get worse. And a lot of times you see the better the remedy works, the less actually you need, not more, in order for it to work better. Which goes back to your point, Lori, is that you're absolutely right that giving medicine is not the first line. And many a times we have to allow the body to heal itself. And as a matter of fact, when you get treated homeopathically, you'll see that I have many patients that they don't even take homeopathic remedy when they go through acute conditions because they're like, you know what, my body's taking care of it so well and I'm not even concerned about it. So you're absolutely right in saying that the medicine should only be used when we see the body itself cannot help itself.
Thank you for that. That brings me to another point that I hear many people confused about, and I always find it hard to explain in my words. So I'm going to ask you and see if you could give me a better way of explaining it in more simple terms, is that there are questions about how to take the remedy. So am I taking it under my tongue? Am I letting it dissolve? Can I take it with anything else? Can I drink water afterwards? Can I have food afterwards? So can you explain that to me?
Of course. So one thing to bear in mind is that you are working with nanoscience, nanoparticles, okay? So as long as you get any number of pellets, we usually say 3 because you make sure that you have some. So allowing 3 pellets dissolve under your tongue. And it is always best to avoid food and water on either side for about 5 to 10 minutes, okay? However, in some situations, that may not be possible, and that doesn't mean the remedy is not going to work or the body is not going to respond. Those are just the ideal situations. Also, times where you're dealing with an infant where you feel like even that tiny pellet is difficult to just put it in their mouth, you can always put a few pellets in a cup, or it could be a paper cup, doesn't matter, and you can stir that with some spring water or a purified water, generally using a non-metal, like a plastic spoon would be ideal. And then you just give them a very small sip of it. And that's considered 1 dose. So there are different ways of giving that homeopathic remedy. But the easiest way is that you just place those pellets without handling them with your fingers. That's why a lot of them have a cap at the end. So once you roll it, they just fall into the cap. So you're not really handling them with your fingers, placing them under your tongue. Now, again, in the case of a baby, you don't need to concern yourself if it goes under their tongue. Just 1 or 2 tiny pellets, going inside it, as long as they start, tasting it, that's sufficient enough. Or if you feel the baby is too small, or it may be sleeping and you don't want them to, for that to choke on it or whatnot, even though they're so tiny and they dissolve right away, you can always dilute them in water, stir it, and just put a few drops of that in their mouth. And that's good enough. That's considered one dose.
When my kids were much younger and I was dabbling in homeopathy, I had always wondered if giving them a dose under their tongue, and lots of times if your baby is still breastfeeding or toddler is still breastfeeding, and if they're sick or they got injured, breastfeeding is very calming to them. So I might have given a remedy and then right away breastfed them. And then there were times when I thought, oh, I don't know, did that give the remedy enough time to work?
So the thing is that the response is dynamic. So once you give the remedy, the body starts to kind of respond. And generally, we ask that if you've not even seen the response by the first dose, you can repeat again within the first, depending on the condition, generally within the first hour or two. And after 2 or 3 doses, if you're not getting a response, that means that is not the right remedy.
Okay, thank you for that. So I know you are local here to me in Phoenix, and I know you work with patients online and you do Skype consults. I'd also like for you to share with us if there's something that specific that you're working on, anything that you're excited about that you wanted to share with us.
Yeah, thank you for asking. Well, one of the things that I'm very excited to work on is called the new homeopathic proving. So these new homeopathic medicines, the way we learn about them is that we take a substance from a nature and we go through that dilution process, and we get the list of volunteers who take this remedy, and they record the list of their symptoms over the next coming month or so. And neither the person that supervises those individuals nor the individuals taking it obviously know that what they're taking. And then what we do is we record all their symptoms and we put this together, and that becomes the result of knowing about a new medicine that is going to eventually help somebody else that may need it. So I'm very excited about a new proving that we're going to start conducting in the next 2 or 3 weeks. So if there are individuals that want to get involved in a homeopathic proving process, the only criteria is that you have to be a healthy individual. You cannot be taking any medication or supplements during this process. And this is another way of actually experiencing homeopathy, of seeing that how a drug can have consistent symptoms and even dream patterns on a group of people. And that's how we learn about the medicinal effect of a new substance. To give an example, we've done at the American Medical College of Homeopathy has done a lot of provings locally here. One is, for example, a saguaro cactus, and another one is a desert tortoise, South African desert tortoise. And they've done many other provings, but those are the two that we have used. Many local patients we've cured them of some really chronic conditions, including asthma, including severe depression, which is kind of very interesting to see that there are elements. Every element in the nature has a curative power, which homeopathy captures and is able to use it for individuals to overcome their condition. So what I'm very excited about is that we're going to be doing a new medicine. In other words, a medicine that has not been proved before, used homeopathically, which we're going to be doing that proving. And once the results comes out, then we share that with the homeopathic community and elsewhere. And they enter those list of symptoms, catalog of symptoms with that particular medicine. So when a patient in a different parts of the world exhibits the same pattern of sleep pattern or physiological symptoms, then they can think of that remedy as potentially something that can help that individual.
Are you in the middle of these particular studies, or is it something that if a listener wanted to see if they were appropriate to participate, that they could contact you?
They can contact us. So they have this is not going to start until the latter part of September. So they have at least good, 2 to 3 weeks in order to get with us if they're interested in participating in the homeopathic proving, at which point, of course, we will give them a good overview of what this process entails. And we would love to have individuals participate because they can help the homeopathic community. That will for sure help someone else in the future to be able to be cured of some condition that otherwise it could have not been helped, and for them to also learn about this homeopathy firsthand of how do we know about these medicines.
That's great. So any of my All About Breastfeeding listeners, you are welcome to contact Ben and tell him that you heard about it from the All About Breastfeeding show. And can you tell us exactly where they would contact you again?
Oh, sure. So they can either go through our website, they can go to click on contact us and send us a message that way. That's homeopathicare.org. Or they can call us directly here at 602-888-7222. So either way, whether they feel more comfortable online or they want to call us directly, we welcome their calls. This could also be with other inquiries that they may have. If they would like to learn more about how to use these homeopathic medicines, or they're a health professional, they like a training, because we have a lot of times free workshops for health professionals about homeopathy, or they would like a homeopathic presentation at their schools or for the community or their social groups or meetup groups, I'll be more than happy to, provide presentations on homeopathy and get to more specifically showing them clinical cases, patients, and get into more in-depth presentation on how homeopathy works.
That's excellent. Thank you so much. And I've been to your very lovely office, and it's a really nice, calming place to be. Met your assistant, Bianca. She's wonderful. So I think that whoever might call you and connect with you will be in excellent hands. And I encourage anybody who has an interest in homeopathy to check out your website and give you a call. Is there anything else, any parting words that you wanted to share with my listeners of pregnant and breastfeeding moms that you think might be of value to them?
Yes, I really feel that this whole process of honoring the breastfeeding and educating the public at large, so we could as a community become more welcoming and accepting and accommodating. I think we can always be, and we need to become more accommodating to all the potential mothers and the pregnant mothers and in this case the breastfeeding mothers, where we encourage them, where I think once our society understands the benefits of breastfeeding, for example, how we need to modify our attitude towards it, how the employers need to honor more extensive time to mothers and also make accommodations on site for breastfeeding mothers, all work environments, and both private and public sector. And I think this is the process of education. That's why we're involved, or anybody else who's involved in the natural healing of things that can help mothers without harming them in any way. I think the more we understand that and we more communicate that can actually bring about a certain level of social change, where a lot of our other problems in the world can be resolved also. I firmly believe that one of the problems that we have now that has contributed to the greater problem that we're having socially, politically, religiously, however you want to look at it, I think it can be resolved by appreciating and educating more the public about the importance of parenting and the mothers and the breastfeeding and the birthing process and all of that. And I think the more we honor that, the more we're going to appreciate other things, and we're going to be able to develop children that are going to come into this world with more compassion and love for one another, that can resolve a lot of the issues that we're having. So I don't see this as a one linear way that, okay, there's a breastfeeding. I see this, if this is done properly and is educated, more public becomes educated, I think we're actually going to see a difference in how we operate socially in all the areas of life.
Well, from a guy, that was said absolutely beautifully. Frequently, I can't say things that my guests say. I just can't improve on it in any way, shape, or form. You are music to my ears, and I love that it just comes totally unsolicited from a male. And I totally agree with you. So thank you so much for sharing that last bit of sentiments and personal feelings from your heart. I appreciate you being here with me on the show. And I welcome my listeners to give homeopathic medicine an opportunity, a chance to help them. And I certainly encourage them to contact you, Ben. So thank you so much for being here today.
My pleasure. Thank you.
This ends part 2 of our interview with Ben. Did you ever meet someone who talks about the work that they do, the paid work? Their love and passion for their work just comes shining through so brightly that you just know this is their life's work. Ben is one of those people doing one of those jobs every day. I have seen him with his family, and I have observed him at work. He's a great guy, and for anyone who is thinking they would like to learn more about homeopathy and want more information, don't be shy. Give his office a call. Check out his website, check out his testimonials, and learn more about how he might be of service to you. Until the next show, bye-bye.